Hello students, we will talk about adrenergic drugs. Adrenergic amines are the drugs that stimulate the sympathetic nervous system. Now these are also called as sympathomimetic drugs. The sympathetic nervous system is a part of autonomic nervous system that originates in the thoracic and the lumbar region of the spinal cord, and that regulates the involuntary reactions to the stress. It stimulates heartbeat, sweating, breathing, and the other stress related body processes. So if you see the classification of adrenergic drugs, it is first basically it is three types: directly acting, mixed acting, and indirectly acting. So let us talk about the direct acting drugs. So here we have alpha agonist and beta agonist. Alpha agonists are again classified into non-selective like epinephrine or epinephrine, and in selective we have alpha 1 agonist and alpha 2 agonist. So alpha 1 agonists are phenylephrine, methoxamine, and in alpha 2 agonist we have clonidine, guanabens, and guafenicin. In beta agonist we have non-selective like isoproterenol or epinephrine, and in selective we have beta 1 agonist like dobutamine, beta 2 agonist like terbutaline, salbutamol, metoprolol, and this is all about directly acting adrenergic drugs, alpha and beta agonists. Indirectly acting we have amphetamines and tyramines, and there is one more class that is mixed acting, that is ephedrine, mephentermine, metaraminone. Noradrenaline or norepinephrine, which is a neurotransmitter of the sympathetic nervous system. Now the synthesis begins with tyrosine, which is amino acid, enters the neuron by active transport, and this is converted into dihydroxy phenylalanine, so we call it as DOPA. This reaction is catalyzed by enzyme tyrosine hydroxylase. Now this DOPA is converted into dopamine by the enzyme aromatic L-amino acid decarboxylase, or we call it as DOPA decarboxylate. DOPA decarboxylase. Then this dopamine is actively transported into the storage vesicles, where it is converted into norepinephrine by dopamine 3 hydroxylase, which is the enzyme within the storage vesicles. So the end product of in the neurons, the end product is norepinephrine. In the adrenal medulla, there is one more step further. The synthesis is carried by enzyme phenylethanolamine and methyl transferase PNMT, that converts norepinephrine into epinephrine. Now then we have the release of norepinephrine, that is the next step. The action potential arriving at the nerve junction triggers, you can see the influx of calcium ions into the extracellular fluid, and then that causes the neuron to fuse with the cell membrane and expel the content into the synapse. So this is the release, and then you have the action on the postsynaptic receptors. Now you have the receptors of the sympathetic nervous system as alpha, beta, and dopamine receptors. Here you can see alpha 1, beta 1, and beta 2. So the drugs that bind to these receptors and modulate or mimic the action of sympathetic nervous system, we call them as empathomimetics. The adrenergic receptors use both CAMP, cyclic adenosine monophosphate, second messenger, and phosphatidyl inositol, cycle 3, to transduce signal into the effect. Then we have the removal of norepinephrine. So either it will diffuse out of the synaptic space and enter into the general circulation. Secondly, it will be metabolized to O-methylated derivatives by COMT, catechol-methyl transferase, or it will be recaptured by the uptake system that pumps this norepinephrine back into the neuron. So this is all about synthesis of norepinephrine, uptake, storage, uptake, and release. Now, potential fates of this recaptured norepinephrine will be like this. Once this norepinephrine enters the cytoplasm of the adrenergic neuron, it will be taken up by the adrenergic vesicles via amine transport system, and it will be sequestered for release by another action potential. Alternatively, it can be oxidized by monoamine oxidase, that is MAO. You can see MAO, which is present in the neuronal mitochondria. The epinephrine is the non-selective alpha and beta agonist. So that means it will stimulate both alpha and beta adrenergic system. So it will cause systemic vasoconstriction, gastrointestinal relaxation, it will stimulate the heart, dilate the bronchi and cerebral vessels. This is used in asthma, cardiac failure, and to delay the absorption of local anesthetics. Now, the pharmacological action depends on the concentration and the number of available receptors. Generally, it has more affinity for beta. At lower concentration, you can say beta effect predominates, and at higher concentration, the effect is alpha mediated. Pharmacological actions of epinephrine. The first we'll discuss is heart. Now, there is a direct stimulation of the beta 1 receptors, and the effect is positive chronotropic and positive inotropic, that is increase heart rate and increase force of contraction. Now the mechanism is epinephrine stimulates beta 1 receptors that activates the G protein receptors, then increases adenyl cyclate, increases CMP, calcium channels open so that calcium influx is increased, and that combines calcium with calmodulin complex is formed, and then increase MCLK production, and then there is a phosphorylation of myosin light chain, then that causes the contraction of the myocardial fiber. So the effect is so this is basically beta 1 mediated positive chronotropic and positive inotropic effect on blood vessels. The epinephrine has vasoconstrictive action, say on the small arteries and precapillary sphincters, while to some extent larger arteries and veins, so there is a vasoconstriction, while the blood vessels of the skeletal muscles are dilated and at low dosage, while coronary and liver this is mediated by powerful beta 2 receptors. We have blood pressure. Now there is a biphasic response of epinephrine on blood pressure. At low concentration, IV infusion or SC injection of epinephrine causes fall in the peripheral resistance, and because you can say beta 2 receptors are more sensitive. At higher dosage, IV infusion produces marked increase in the systolic as well as diastolic blood pressure. So this is a biphasic response of epinephrine. That means at lower dosage, fall in the blood pressure, and higher dosage increase in the blood pressure. Then we have on the smooth muscles. This is again important effect. Now the GIT smooth muscles are relaxed, and this effect is mediated by alpha 1 as well as beta 2 receptors. And the alpha 1 receptor activation causes increase in the potassium influx and hyperpolarization of the muscle cell. Beta 2 stimulation will increase systolic cytosolic concentration of cyclic AMP. This in turn produces protein kinase and stimulate the other enzyme. After 2-3 such steps, that leads to dephosphorylation, inactivation of myosin light chain, and then stimulation of the alpha 2 receptors will inhibit the release of excitatory neurotransmitter, that is acetylcholine. So all these three responses combined together will cause relaxation of GIT smooth muscles. Then we have respiratory effect is beta 2 activation, increase CMP, so that bronchial smooth muscles are relaxed. Then we have on effect on eyes, mydriasis because of the contraction of the radial muscles of iris. Cardiac arrest, adrenaline, cardiogenic shock, we have dobutamine, dopamine, and in heart block, which we have isoproterenol. So that is on cardiovascular system.
Anaphylactic reaction, we have acute anaphylactic reactions, type 1 hypersensitivity. The drug is adrenaline. Miscellaneous, we have used with a local anesthetic to prolong the action, that is adrenaline, which is a vasoconstrictor. Bronchial asthma, epinephrine, isoproterenol, salbutamol. As a decongestant, epinephrine, and ophthalmic use to dilate the pupil. We have phenylephrine and ephedrine.
We will talk about norepinephrine. This is found in the plants and pharmacologically used as sympathomimetic, precursor of epinephrine, which is secreted by adrenal medulla, and this is the principal transmitter of the postganglionic sympathetic fibers. It acts on both alpha and alpha 1, alpha 2 receptors to cause vasoconstriction, and functions as a peripheral vasoconstrictor by alpha adrenergic receptors, and this is also inotropic stimulator of the heart and dilator of the coronary arteries as a result of the beta adrenergic receptors. So norepinephrine is mainly used to treat patients in a vasodilatory shock states like septic shock, neurogenic shock, and has shown benefit over dopamine, and also used as a vasopressor medication for patients with critical hypotension. The brand names is Nordrine, Adrenor, Noradvescu. Beta agonist. First one is isoproterenol, also called as isoprenaline. This is ineffective orally and selective beta 2 adrenergic receptor agonist. So the stimulation of the beta receptors of the intracellular adenylyl cyclase causes increased cyclic AMP, and that levels associated with the relaxation of the bronchial smooth muscle. It also inhibits the release of the mediators of the hypersensitivity from the mast cells. So isoproterenol is indicated for the relief of bronchospasm associated with a COPD, that is chronic obstructive pulmonary disease. Then we have phenylephrine. This is a sympathomimetic amine predominantly acting on alpha 1 adrenergic receptors. The stimulation of alpha 1 receptor results in the contraction of arteriolar smooth muscle in the periphery and decreases nasal congestion by acting on alpha 1 adrenergic receptors in the arterioles of the nasal mucosa to produce constriction that leads to decreased edema and increased drainage of sinus cavities. So basically phenylephrine is used as a nasal decongestant. It can also be used for treating hypertension and shock, prolongation of spinal anesthesia, symptomatic relief of external and internal hemorrhoids. We have clonidine. This is a imidazoline derivative which crosses the blood-brain barrier and acts in the hypothalamus. This is a centrally acting alpha 2 adrenergic agonist. Now this acts by this mechanism where alpha 2 receptors, they regulate the number of signaling pathways mediated by multiple GI proteins, and the stimulation of alpha 2 receptor produce effect like inhibition of adenylyl cyclase, stimulation of phospholipase D, stimulation of the potassium current, and inhibition of calcium currents. And this is available as brands as Catapris tablet, and it's mainly used to decrease the blood pressure. We have Dobutamine, which is selective beta 1 agonist. This is a directly acting inotropic agent, and it is acting on the beta 1 adrenergic receptors. So directly stimulation of beta 1 receptors that increases myocardial contractility and the stroke volume results in increased cardiac output, and this is proposed as a cardiotonic after myocardial infarction or open heart surgery. Then we have selective beta 2 agonists. So these are particularly used as a bronchodilators and tocolytic agent. We have the drug called Dobutamine. This is a selective beta 2 adrenergic agonist, and the mechanism is similar as we have discussed in isoproterenol. This is used in the management of bronchospasm, bronchitis, emphysema. And also it is used acute IV in selected women to inhibit the uterine contraction in the premature labor. That is effect. This is called as tocolysis and prolonged gestation. Now Dobutamine is used as bronchodilator is in the brands Bricanyl. We have salbutamol. This is again beta-2 adrenergic agonist, similar in structure to Dobutamine. Mechanism is again similar. And this is used in the treatment of asthma. Very good drug, and number of brands available in the market. So in the treatment of asthma and COPD. In addition to bronchodilation, it inhibits the release of bronchoconstricting agent from the mast cells and inhibits microvascular leakage and enhance the mucociliary clearance. We have Orsiprenalin. This is a beta adrenergic agonist and also known as metoprolol. So, this is synthetic amine, structurally pharmacologically similar to isoproterenol, and the mechanism is also similar. This is exclusively used as bronchodilator. And we have ephedrine. These are the mixed acting adrenergic agents. This is similar in structure to the amphetamines, methamphetamines. Chemically, this is alkaloid obtained from the various plants in the genus Ephedra, family Ephedraceae. And this works mainly by increasing activity of noradrenaline. You can say by directly acting the postsynaptic alpha receptors and the beta receptors. This is transported through noradrenaline reuptake complex and enhance the release of norepinephrine. So this is used in this treatment of several disorders including asthma, heart failure, rhinitis, urinary incontinence, and for CNS stimulatory effect in the treatment of narcolepsy and depression.